You're listening to the Make Mental Podcast. Hello again, beautiful people. Welcome back to part 2 of this conversation we are having with Chris Johnson from Clear Oncology. In this portion of the conversation, we talk a little bit more about his personal life, how he leads with love, compassion, and has very high moral standards. And then we get more into his work in the mental health and oncology space. So please stick around for the rest of this episode. Let us know your thoughts. If you haven't listened to part 1 already, I encourage you to do so. And before we head into the conversation, let's just take a moment and thank our sponsors.
What's up, Make Mental listeners? I'm Alyssa Herman, former athlete and founder of Beyond the Athlete. If you are a former athlete too, then you know the hardest part of retiring isn't leaving behind your sport, it's losing your teammates. This is why I created The Locker Room, an online community where former athletes rebuild structure, purpose, and healthy competition, all alongside a new team who truly understands them. Make Mental listeners can join free for 30 days. Just use code MAKEMENTAL at the link below to request your spot on the roster.
You know, one thing I've learned while running Make Mental is that the conversations are the easy part. It's creating content and getting it out there that takes the most time and energy. That's why I started working with C3 Socials, and honestly, they have been a lifesaver. They've been running my Instagram, TikTok, and YouTube for the past few months, and in just the last 90 days, over 350,000 people have visited my Instagram alone. But the numbers aren't even the best part. It is the time and energy that I've gotten back. Chandler, the owner, is super personable and always available. Seriously, it's crazy how hands-on she is. So if you're trying to grow your brand or just free up some headspace while getting results, check out C3 Socials. Tell them Make Mental sent you because they've helped me tremendously, and I cannot recommend them enough. So relatable, Chris. So relatable. Obviously not necessarily in the yelling at your boss way, but we've all been there where we thought it's the final scenario. We thought the outcome that we got is not what we deserved, and it's not even the full outcome yet. It's just the tip of the iceberg, and you're not alone. I've done that. Not in that case. I think I've yelled at a couple coaches, yelled at a couple refs. Well, more than a couple refs, but that's a whole different subject. Actually, we could talk about that for a bit. One of them, so his name is Jeff as well. I think you mentioned Jeff, right? Did you say? No, you said Keith.
Keith. Yep. Keith was
well,
his
not
name.
Jeff as well. This is just Jeff.
Yep.
Refed me since I was growing up, since I was really young. Good ref, good guy.
Yep.
But when you're in the heat of the moment, awful ref, horrible call. What are you doing? Anyway, lo and behold, I show up to my current job in a different office that I'm in now. I get hired 3 days before the Christmas party, and I show up to the Christmas party only knowing the people that hired me and just like 2 or 3 people that I sit next to. Yep. And I see Jeff here at my new job, and I immediately like turn around, grab a glass of wine, and I'm like, oh crap, like I need to finish this wine. But he spots me from across the room, and he's like, what are you doing here? And I'm like, oh, hey, Jeff, I just got hired. And he goes, oh, like what division? I tell him, and he goes, oh, cool, you'll be doing some work for me. And I'm like, oh my God. I literally 4 months before I got a yellow card for yelling at him in the game.
Yeah.
Fast forward again to now. I haven't seen him probably in about a year since I transitioned offices and roles. I'm on a new team, coaching a new team, and he's roughing the game. And I yell at him again. And immediately after I yell at him, I'm like, oh, he's still my boss. In the middle of the game, he stops the clock. He's such a nice guy. He stops the clock and he calls me coach. Not just so it's normal. Pulls me to the corner. He goes, could give you a yellow because you screamed at me, but I'm not going to. He goes, I understand. Heat of the moment. You had an injured player down that I didn't realize. Just let my 4th official know. Just let's calm the situation down. So similarly to your boss, he knew the situation. He understood that why I was yelling, looking out for my players, but he also understood the relationship and the dynamic and like that I do look up to him. So it's one of those scenarios where it just goes to show you, number one, you never know what the outcome's going to be until you think about it, till you give it those 24 hours. And number two, you're never going to get past that moment where you're 100% perfect and you wait exactly 24 hours. You're going to scream. There's going to be heat of the moment. It's one, can you diffuse the situation after you've made people angry? Or two, have you surrounded yourself and put people in your corner who are very calm in those situations and who have been in your situation enough times? So I think I appreciate that point that you brought up of, if you can, let it sit. I think we've been a little humble for you. You've been in some prestigious positions at some very well-known companies. How do you handle situations like this now as a boss, not a father, as a boss
Mhm.
when, say, someone in your shoes years ago comes to you and is like, Chris, I need $150,000 or I'm hitting the road. And they're a
Yeah.
very good worker and you want them here, but you're not giving them $150,000.
I always go back to what it was like when I was in their shoes, and I never forget that, and that keeps me well grounded, and I'm always very open and honest with people. You'd be surprised, Caleb, how many times people have approached me and said, "I'm interviewing. I'm gonna look, I'm contemplating going to this company XYZ," and they're shocked because I say, "Good for you," and they look at me crazy. And I say to them, when you're ready and they make you an offer, let me know. And then I'd love for the two of us to sit down and go through basically the pros and cons of you sticking with us or the pros and cons of going there. If the pros and cons are better for you to go elsewhere, I will be the first to tell you we can't meet that offer. You got a better offer. Go elsewhere. And I tell them because there is going to come a point in time in oncology specifically, the world is so small that our paths will probably cross again. If I told you to do something that I didn't think was in your best interest, then that's going to come back to me. And I don't want that to happen. I would rather lose somebody that is a good quality person and let them flourish and have that opportunity elsewhere if we can't make it happen for them here. And I've always stuck by that. And you'd be amazed at how many times I go to meetings within the oncology space and I come across somebody that I worked with 20 years ago. And when they come up to me, it's not just a handshake, it's a hug.
Mm.
I'll never forget when you told me this, or I'll never forget when you told me that. So one of the biggest things that I love to do, I love to mentor. I love to take the time and talk with people. And I always let them know I'm going to give you an unbiased point of view. And I'm also going to be very realistic. You might not like what I have to say, but I'm going to be honest with you.
Mm.
And fortunately, it's like the situation with Mark Reese. If I didn't have Mark Reese during that time, I don't know if I'm in the position that I'm in today. I don't know what our family looks like. Like I could have missed out on a ton of opportunities. And because of that, I think to myself, I was fortunate enough to have a Mark Reese in my life. I want to pay it forward and be the Mark Reese for other people to come.
Yeah. Yeah, that's fantastic. I think I know this, but for our listeners, they can get a sense that you lead with love now, and that is not always the case, especially in corporate world, especially well, I guess you try to lead with love in the oncology department, but so many times there's so many disappointments and heartbreaks and challenges that it's almost damn near impossible to. When you make that choice though to lead with purpose and intention
Mhm.
and really wanting the best for the person you're working with for or letting go, that's not normal. First of all, it's very hard to say like I'm going to lose a good worker but they're going to flourish at a different company that could affect mine, right? But at the end of the day, what you put out into the world comes back to you. That's my belief.
Yep.
Whether it's tenfold or not, like you said, 20 years later it comes back in the form of a hug or a newfound relationship or
Mhm.
a new spot at your company opening up. They have experience. They want to come back and work for you because of something you said 20 years ago.
Exactly.
If that's not possible and they
Mhm.
need a little slap on the hand, how can we learn to one deliver that gently but also receive it gently? Kind of like you said, your boss kind of was like, "Hey, you need to calm down. That's only 20% of your raise, but it's
Yeah.
still coming. I'm not going to withhold it from you."
Yeah. There are times when I believe that I have had people that purposely take advantage of the system. And when they do, I handle it appropriately. To give you an example, we had a gentleman, you were given a per diem each day. This is back in like 2001, but you were allowed to, when you travel, you were allowed to spend $85 on a meal wherever you went by yourself. $85. So it doesn't matter if you're at Ruth Chris Steakhouse, it's $85. It doesn't matter if it's at Chipotle, it's $85. I don't know anybody that can eat $85 worth of Chipotle, but you have $85 to spend. This individual, what he would do is he would have these overnights. He lived in Northern California and he'd drive up to Oregon and he'd work the market in Oregon. And he would go to Chipotle and he would get a meal, a burrito for, $7, whatever the case may be, right? And then he'd go to a wine store and he'd buy 2 bottles of wine that were $35 a piece. So he was coming underneath that $85. He had all the right to do so, right? And so his boss came to me and said, every time that he goes to Oregon, he's drinking 2 bottles of wine. And she goes, I think he's taking advantage of the company and the policy. And I agreed with her wholeheartedly, right? And so I said, there's one of two ways that we can approach this. He is in line with the guidelines, right? But he's clearly taking advantage of it. The other thing is, I personally am concerned if one of my people are drinking 2 bottles worth of wine each night, we might have a problem here that we need to address. So we got on a conference call, and it was the gentleman, his boss, and myself. And I called him from a place of concern. And I said his name and said, I'm really concerned. Your boss has been looking at your expense reports, and it looks like you're consuming 2 bottles of wine per night. And he's like, everybody calls me CJ, right? And he goes, CJ, he goes, oh, you don't have to worry. He goes, I'm not drinking this. I take those bottles of wine home with me. That's what he said, right? And I said, okay, I appreciate that. Let's talk about that. The per diem is for your meal, not for you to take home food or drinks to eat at a later date and time. I said, for example, I said, when I travel, if I go just like yourself and I eat at Chipotle, I don't go into the grocery store next door and buy groceries for my family to take home. And he goes, well, it states right here in the guidelines that I can. And I said, you're exactly right. You're exactly right. You did. And you're not in any kind of trouble. But I can tell you this, if you had your own company and you gave them an expense account and you knew that they were doing this, this is your company that you're paying for. How would you feel? And he got real quiet. And I said, would you feel like somebody's taking advantage of you? And he got real quiet. And I said his name. I'm trying so hard not to say his name on right now as we're speaking, right? And I said, you're currently in the management development program. But I can tell you this, if I had a manager that was capable of doing something like you're doing right now, I don't know what else you're capable of doing that we're not aware of. And I'm not gonna put up with it. So he stopped doing it. He still was in the management development program. When he interviewed, he didn't get the job because people knew what he had done. And he eventually left the company. Another scenario, we had a gentleman that was buying all of these computer pieces. I was getting on the expense reports, I was getting a receipt for Fry's Electronics all the time. And I didn't know. So I called one of my buddies and I said, his name's Trung. I said, Trung, this guy's buying this, and I read off what he was buying. He started laughing. He goes, yeah, you know what your rep's doing? I'm like, what? He's like, he's building a computer. He's just expensing each piece every 2 weeks. And he says, in about 6 months, he's going to have a whole computer built up. And I was like, are you serious? So then,
he better be using that computer for work.
Yeah, exactly. Which he wasn't. It was all personal. And so, in that scenario, you have the conversation. He didn't own up to it. If somebody owns up to it, I'm willing to give somebody a chance. But if they're just blatantly taking advantage, it's time to cut them loose.
Yeah, you got to respect your piece while also respecting theirs, right? You have to, at the end of the day, you have to go home with yourself. So as long as you can uphold your values or withhold your values or those of the company that you're representing respectfully, while respecting theirs, like you said, if they're willing to, we'll call him Wine Guy. If Wine Guy is willing to uncork his own ego and pride and open up to that, fine, right? Like, again, you make a mistake. It's not like it was costing the company $8 billion a year, but it was still enough to where it raised concern, one, about the health of the individual, which I think is more important for the time being. But two, it's just the principle. It's the ethics behind it. And like you said, if you want a leader, if you want to be a leader, you have to put your best foot forward every day. And sometimes your best foot forward is owning up to your mistakes, right? Because we're not perfect. I want to fast forward here to current day, current
Yeah.
time Chris.
Yep.
Who is current Chris?
Current Chris is somebody that has gone through so many different experiences in life that I feel like I'm in a really good place. And what
Hmm.
I mean by that is I do a lot of self-reflection. Um, I look back at a lot of the mistakes that I've made, and I've picked up the phone and called and apologized to people that I've made mistakes to. And I've been very fortunate that everybody that I've contacted has actually been very warm and receptive. Um, I'm in a place too in which I have taken probably one of the biggest risks in my life in walking away from a pretty high corporate level position to go out and venture and start a new company with another individual and taking a huge risk. However, I do feel that the risk that I've taken is going to pay off handsomely, and not just pay off from a standpoint of a financial standpoint. That's not what I'm talking about. I think it's going to be a game changer for patients, and specifically cancer patients. My dad's side of the family has been riddled with cancer. My mom's side of the family has been impacted by cancer as well. And then both sides of our family have been impacted by mental health. And for me to have the ability to bring those two together, and now that's my focus, I feel like I always state this. If a physician were to treat a patient's mind with the accuracy and precision that they treat their disease, the level of care will increase and the outcomes will be better.
Hmm.
And I truly believe that. My wife and I were talking this morning. When a oncologist has a patient come in, they can't look at the patient and tell you what's happening with their blood work. You can't see it. Just like with your mind, you can't see it, right? So the first thing you do when you walk into an oncology office is they take your blood and they analyze your blood, and then it lets you know if the treatment that they're on is working, if the side effects from the treatment, how they're impacting you. It basically gives them a guide of what direction to continue. Are we going to continue on your chemotherapy? Are we going to continue on this, this particular product, or do we have to course correct and go a different direction? Right. My goal is for that exact same thing to happen. When you go in and you check in for your oncology appointment, you're handed one of our tablets and you go through a mental health screening and testing assessment. And now the physician not only looks at your blood work before walking in to talk to you, but he also looks at the results of that assessment. And now he sees, do we need to get you additional help or can I handle this on my own? And that's the way I believe we need to treat our patients in the cancer community. I feel if we do that, the level of care will increase, outcomes will be better. This day and age that we are, where we treat the body, but we don't treat the mind, we're better than that. And that's
Hmm.
the goal, is to change that.
Yeah, I wholeheartedly agree with you on everything you just said, but I'm going to throw a question at you
Yeah.
as someone who doesn't agree with you, if that's okay.
Well, that's perfectly fine.
All right, this is my
Perfectly fine.
alter ego speaking right here.
I
So,
love it.
well,
I love it.
Chris, you're ridiculous, man. Cancer patients are already so stressed out. What the heck makes you think they're going to want to fill out an extra form, talk to someone else about what they have going on? They'd rather treat what they've got going on with their body and get the hell out of it.
You're exactly right. There will be some patients that will feel exactly the way that you do. You can't force them to do anything. Can't force them to. But there are going to be other patients, the majority of the patients, that are screaming inside for help, yet they don't know how to ask for it. They don't want to say anything because they don't want to burden their caretakers. They don't want the rest of their family knowing how they're feeling. And that tablet is their escape. That's the opportunity for them to say, maybe I can get some help. Nobody else has to know about it. My physician can then refer me to somebody. I can start to talk to somebody about it and not make my spouse feel bad, not have my kids worried about me. They're already worried as it is because they know I've got cancer. One of the things I always talk about when I meet with physicians is you're going to have patients that are going to come in, and without our software, they're either going to present two ways. They're going to come in and they're distressed and they're going to let you know it. They'll be crying. They'll be wondering what's wrong with me, so on and so forth. And in those situations, the doctor unfortunately is flying by the seat of their pants, but he's going to do his best he can to help, right?
Mm.
Or she will do the best they can to help. That same person, that same exact person, or a different person that is completely distressed presents as not saying a word, and the physician has no idea that they're coming apart. They're just unraveling mentally inside, and nobody doesn't say a word. So the physician thinks full steam ahead, we're good to go. 2 weeks later, that patient commits suicide.
Mm.
Physician never had a clue. We now have the ability to give them the answers to that test, so you know what's going on in that patient's mind. If that patient chooses not to fill it out, that's on them. We can't hold the gun to anybody's head. We can't make them do anything they don't want to do. But I can tell you, I think the majority would love to know that, hey, they're being heard and they're being treated. And that's the goal.
Yeah, so beautiful. I think, correct me if I'm wrong here, but I think Clear Oncology serves as that river to sit by that you mentioned
Yes, it
earlier. It
does.
serves as, for a lot of people, it will serve as that 10 minutes of silence so they can have their brain relax and attack the cancer or attack the mental health issues or struggles, not even issues, just the mental health that comes with cancer, right?
Yep.
Just because it does. It's not, you can't separate them, right? Your body
Right.
struggles, your brain struggles, your brain struggles, your body struggles. You're an individual as a whole. It's almost impossible, as you said, now to separate those. So Clear Oncology providing that moment, that software for human beings to just breathe for a second, answer honestly without judgment, and know that the level of care they're about to get will increase. Or if it's not going to increase, at least be directed properly
Exactly.
is more than enough. And I know you're a huge proponent, you mentioned, of not necessarily doing things for the money. And we really appreciate that. How have you come to believe that in a world right now where all we're seeing, I mean, heck, I brought it up in the beginning. I brought up the stock market for some crazy reason, just money on the
Yeah.
mind, I guess. I'm with you. I think we should do things. Obviously, you have to provide for yourself, but I think we should do things
Right.
that bring you more than just money, bring you joy. How have you been able to get to that point in your life where you're just like, I need to do this because it's the right thing to do and it will help so many and the money will sort itself out.
Exactly. You just have to have belief in what you're doing, have faith, and put your best foot forward every day. I know, and in talking with you, Caleb, and talking with the physicians that we're working with currently, um, my goal is to make this standard of care so
Mm.
that every time a patient goes in, they're getting screened mentally. And that may seem a little far fetched. That's okay. That's okay. But as long as we can impact patients in the right way, I'm going to be happy.
Mm.
If we can make it standard of care with this, the money will follow. And in these situations for physicians to utilize our software, we're not gouging them. The price is very fair. They agree to it. There's never been anybody that's balked at it from that standpoint. It's very minimal. And fortunately, it's the right thing to do for the patient. It's the right thing to do by the practice. The practice actually gets reimbursed by doing these screenings. So they actually stand to create an additional stream of revenue for themselves. And the last big thing is we track all of that data, and we're going to start to utilize that data to start to identify trends in terms of certain tumor types, certain types of
Mm.
chemo regimens that will then help so that we know what to kind of predict will come along from a mental health condition or perspective, excuse me, based upon the exact tumor type, a chemo regimen, things of that nature, which will in turn create a better level of care as well.
Yeah. Money is a side effect, not as a driving factor, seems to be
Correct.
when people find their most inner peace. And again, like you said, there'll be moments when you're climbing up the mountain and you fall in and you're like, oh crap, I need a couple thousand right now. We have to figure this out. But again, that's anything.
Yeah.
That's health, that's with money, that's with relationships, that's just life. That
Yep.
and again, for better or worse, you need it to survive money, but it should not be number one every single day if it doesn't have to be. Again, if you are in that point where all you're thinking about is money and you're struggling, reach out. People will help you, people will guide you. There is resources, but if it's not an everyday thought, if your necessities are taken care of, and you could start to make money as a side effect, as I put it, kind of like that. I might put that on a shirt. Um,
Well,
that's
I
when
think,
real impact is made. So,
yeah. Well, and we think about it. A job is there to provide money, right? So people
mhm.
go to a job not because they love it, because they want to make money. Let's be real, right? I don't consider this as a job. I consider this as my passion. And if I'm doing right by others, this passion that I have will then create a better place for everybody that I'm trying to impact, and the money will follow. It'll come.
I always say even priests get paid
Yes.
and a place to live in
Yes.
whatever. So
Yes.
even those we hold high, they still get paid to do their job. And look, they do create it for the most part, I will say. Everything has its downs, but for the most part, the religious community has created a nice place to belong for so many people. So I want to
Exactly.
open up the floor to you here, Chris.
Yeah.
As we come towards the end here
Mhm.
of our part 2, what did I miss? What did I leave out? What is important to you in the mental health space, in the cancer space, and in the everyday life space that we didn't touch on today that you think people should know about?
I think number one, within the cancer space specifically, the moment that somebody is diagnosed with cancer, not only is their life turned upside down, but the spouse's life is turned upside down. Their children's lives are turned upside down. So I think we really need to take a look, and we have so much focus on the patient, but I think we need to also consider the caregiver as well as their immediate family members. That's probably number one. Number two, depending upon what stage you are in the cancer journey, your mental health is going to be a roller coaster. From the moment you're diagnosed, am I going to live? What about my kids? What is this going to look like? How is it going to impact our finances, right? As they're going through treatment, I hope this is working, right? What if it's not? What are my options, right? They're now in remission. Is it going to come back? What does that look like if it does come back, right? Am I doing okay? Do I have anxiety when I go in to take a look at my scans, right? With what's happening? Recurrence, it has come back. Do I need to do a clinical trial? Do they have a second line treatment now? Am I going to live this time around? Do I have the energy? Do I believe I can make it this next go round? And then survivorship. They say I'm in the clear, but am I really in the clear? Is it going to come back? Can I help others? So there's so many different things, and it is just an up and down process as you go with it. The good news is if you get diagnosed early, the chances of you surviving cancer and living with the cancer are very likely nowadays. Versus when I started in this industry back in 1996, you were diagnosed with cancer, you really probably were going to pass away from the cancer. And, almost 30 years later, now cancer is looked at as almost a chronic disease. So those are probably the biggest things that I would stay focused on. In terms of mental health is all around us every day. It's around us every day. And I don't want people ever feeling ashamed of the conditions that they're going through. I think that used to be the case when, 20 years ago. But now our youth especially are going through the anxiety that exists with our youth these days is just it's overwhelming. And you take a look at the homelessness that we have within this country. A huge proponent of that is due to mental health, and nothing's being done about it. And that's some of the things that I think we need to continue to focus on. I can't solve the world's problems, right? But I
Oh, come
do
on,
believe that,
Chris. Come
yeah,
on.
I do believe that we need to focus much more on mental health in this country. I definitely do. And I don't think people should feel ashamed of having a mental health condition. When you sit there and say, is it normal? Unfortunately, it is normal these days. And not knowing somebody, not being impacted by mental health, um, that's not normal. That's not normal. And you're just not being realistic these days. That's the case. So,
Yeah, I'd argue that it's always been the case. We have more vocabulary for it now. We have
I
more
think you're right.
experience with it, and for better or for worse, sharing like you have allows us to understand a little bit more, to make light of such a strange, unknown world of mental health.
Yep.
Because like you said, I can't look. I don't know if you're faking a smile for me today, Chris. I don't think so. I'd like to think that, but you
Right.
just don't. You don't know, and then vice versa, right?
Right.
Like I could have just had the
Yeah.
crappiest day before this. I could talk to you, like that's what you're saying. If you're not impacted by mental health, you are. Someone in your life is. You just don't know. in your screening for the cancer world will help at least that individual know. I think we need a Chris for every industry. That's going to be my new catchphrase. A Chris for every industry is going to be the headline of this episode.
I love it, Caleb. I love it.
And I think if we have at least a proponent for each portion of life, then the conversation goes in the right direction. The actions will follow, and the betterment of everyone will happen. I know it sounds like I'm on a Miss Universe pageant right now, but I really truly believe that if we just lead with love and intention,
Yep.
and like you're doing for the correct reasons, everything else will sort itself out. We don't have to complicate it. We don't. Okay, so you might be able to tell I'm in a different location, possibly a different hoodie. Honestly, I don't remember what I was wearing last time we recorded with Chris, but I had some technical difficulties, excuse me, on my end. And we didn't want to forget about the final question that we ask every guest, because I think this would mean a lot to Chris and to you guys. So, Chris, if it's all the same to you, I would like to ask you that final question that we ask everyone.
Sure. What is it?
If there is one person in the entire world right now who needs a hug from you and why, who would that be?
That's a good question. It's a good question. And I'm probably going to answer this a little differently than most, but it wouldn't be one person. It would actually be the family members and the friends of the cancer patient. And the reason why is when a cancer patient is going through their journey, all the focus is on that patient, rightfully so.
Sure.
It's their journey, right? However, a lot of times the work that is put in by the caregiver and the stress and the strain that they go through is usually not being dealt with. I also think that if you take an example of a breast cancer patient, for example, and let's say she happens to be a mother of two and the kids are in high school, those kids are going to go through a lot mentally as well. That husband is going to go through a lot as the caregiver, most likely. The parents that are still alive are going to go through a lot, worried about their daughter. Cancer creates a ripple effect, and it has such an impact on people from a mental health perspective that I don't think people take the time to realize its impact on them mentally. And if I could give a hug to anybody or a group per se, it would be those that have been impacted and are currently impacted by a family member, a loved one that is going through treatment for cancer.
Yeah, Chris, you never cease to amaze me on your different perspectives here and who could use hugs, but we really appreciate that. Again, just coming straight from the heart for you. This whole episode talked about your story, the story of what you're doing now, and then those who you serve. And again, I think fits the theme of this episode perfectly to lead with love and in service of others, even the caregivers, because as you mentioned, they unfortunately get overlooked, which is not always the right thing, but it happens. So we appreciate that perspective, and for taking the past, I don't know, hour and then a week and now a couple more minutes with us. We'd love to have you back on so we can follow your journey and hear more about what you're doing.
Without a doubt, I really enjoyed this, Caleb, and hopefully the next time that we're on, our business will be flourishing and more people will know about what we're trying to do. And the goal ultimately, like I said, is to make mental health standard of care for the oncology patient. And if that can happen, it will just, we'll definitely see improvements from not only the patient's outcomes, but the data that will come along as well, I think will be extremely rich.